Thank you for turning to NBC 10, the team you trust. This is NBC 10 News at 5:30.
Tonight in Health Check, a new, less invasive way to treat a common knee injury. Here's Barbara Moore-Silva. Hi, Barbara.
Hi there, Gene. This common knee injury involves the ACL ligament. It tears or rips, and right now the minimally invasive arthroscopic surgery is the gold standard. Now there's a newer version that's even less invasive. It requires an incision about the size of a small fingernail, and it's being done locally by the team orthopedic doctor for the Providence College Friars men's basketball team. 18-year-old Ashley Williams should be preparing for her first basketball game at the Community College of Rhode Island.
Ashley, how are you doing today?
Good. Instead, she's meeting with her orthopedic surgeon, Dr. Franklin Mirrer, in preparation for knee surgery.
I heard it on a second day of practice. We was playing a scrimmage, and then I was running down the court, and my knee just gave out. I felt a pop, and the next thing you know, I was just on the ground.
Ashley tore a ligament in her knee known as the ACL, one of the 4 main ligaments in the knee.
It's a very common injury in athletes. I would say more common in females than it is in males.
Ashley will be undergoing a new type of arthroscopic knee procedure. Instead of the main incision being about 2.5 inches long,
this incision is about 1.5 to 2 centimeters.
About the size of a small fingernail. And unlike traditional arthroscopy, all the repair work will be done from the inside out.
And that provides better fixation of the graft where it actually belongs, or where it is normally or naturally in the knee, rather than fixing it on the outer edge of the bone. So it provides more stable fixation, provides a lot less bleeding, a lot less pain.
Less than 24 hours later, Ashley is in surgery for her all-inside ACL reconstruction. This is how it works. Using an arthroscope to look inside the knee, Dr. Mirrer drills from the inside of the joint out. He says it helps ensure the integrity of the bone itself and that it's less invasive than the standard procedure. And
the initial recovery is faster because there's less pain. So patients are able to get back their full extension and in many cases almost their full flexion within a week or 2.
2 days after surgery, Ashley is in for her post-op visit. Her main incision quite small.
Usually the incision's about that long.
And he has Ashley try something.
Beautiful. So what she can do right now is a straight leg raise. And most of my patients that I did the older surgery on with the bigger incision and the different way of fixing the graft can't do a straight leg raise at 5 days after surgery. And I think that within 5 to 10 years, it will be the way everybody does ACLs.
Dr. Mirrer says right now he's the only surgeon in our area performing this more difficult, complicated procedure. He works out of Kent Hospital. It must be noted, though, long-term, the time it takes for the ligaments to grow back to the bone is the same no matter what procedure is performed. Dr. Mirrer expects Ashley will be able to play basketball again in about 3 to 4 months. For more on this new procedure, you can call Dr. Mirrer's office at 401-739-9050. And that's Health Check. Barbara Moore-Silva, NBC 10 News.